Intellectual disability is a term that we use to describe a child whose ability to learn and function in daily life is limited as compared to other children their age. This means that they may have a hard time letting others know their wants and needs and taking care of themselves in a way so that they are independent. Intellectual disability varies a lot amongst children. It can be of different levels. Every child with an intellectual disability, just like all other children, is unique and has their own sets of strengths and challenges. Intellectual disability may cause a child to learn slower than other children and develop more slowly. What this means is that the child may learn to walk, learn to talk, dress themselves, eat by themselves, or learn at school at a pace that is slower than other children their age. No matter how many experts you see on child development, remember that you are the expert on your child. Nobody knows them better than you, and no one is as invested in their development as you are. With your support and the support of your community, your child will certainly learn, go to school, make friends, have fun, and be a very important part of your family and community. The future of a child with intellectual disability really depends on a lot of factors. Some of them are within the child themselves, so the level of intellectual disability. So the more severe the intellectual disability, the less likely it is that the child will learn to be completely independent. But majority of children with intellectual disability, actually over 80%, have mild intellectual disability. So what that means is that this child certainly will grow up to learn, to go to school, to be independent and be a very important member of the family and community. They certainly can hold certain kinds of jobs as well and work towards financial independence. Intellectual disability is often measured using an IQ test. Unfortunately, IQ tests only measure one kind of intelligence. Many times children with intellectual disability have other kinds of intelligence. They may have wonderful social intelligence and may be great with people. They may have great nature intelligence and may be wonderful outdoors. They may be interested in art or have really good body language or body intelligence that makes them excel at physical tasks. So it's really important to find out the strength of the child. Where are they doing really well, and leverage that to develop what might become their future career. So the formal diagnosis of intellectual disability may not be made until the child is over 6 years old, because it is hard to perform IQ tests, etc. Below that age. But the clues that you may have is that if the child shows developmental delays in more than one area of development. So for example, if the child is slow to learn to speak, to understand, the way they solve problems, then this may be a clue that the child may have an intellectual disability. The most unreliable way of telling actually if the child is slow to move. So motor delays or physical delays are the least reliable way of telling intellectual disabilities. If you suspect your child has a developmental delay or a child that you know has a developmental delay, it is really important to get them assessed as soon as possible, because early intervention makes a difference. Now, the person you get your child assessed by will depend upon where you live. It needs to be an expert in child development. So if you live in an area where there is a developmental pediatrician, that is a children's doctor who's an expert on child development and disabilities, then that would be the person to see. In some areas, that person may be a psychologist, a pediatrician, or someone else. At the assessment itself, the expert on child development may ask you questions about your child's birth, your child's development, and your family history. In addition, they may talk to your child and play with your child and do some tests to look at your child's development. Most importantly, the expert on child development should be able to tell you what you can do as a family to support your child and how you can take care of yourself in the process. There may be other people involved in the process of assessment. For example, a social worker may be able to help you get a disability certificate, which in turn may help you access a lot of facilities. An occupational therapist may be involved in helping your child learn to be independent by learning how to perform activities of daily living like eating by themselves or dressing themselves. There may be a psychologist involved in the assessment who assesses your child's IQ or ability to learn. And the psychologist may also be a counselor who helps you and your family cope with the diagnosis and handle other mental health concerns that may exist, like anxiety and depression. If you found this video helpful, do like and subscribe to this channel.